Welcome to the official channel of Bashkir State Medical University. So my medical practical cycle was going on. Then me and my team decided why not to film it. This will give a broad idea to other medical students and this also helps us to improve our medical practical skills. So we started our practice by taking blood sample and analyzing it.
We are posted to the Hospital 21 Cardiology Department and we diagnosed a patient with the help of cardiologist.
The patient was male with a height of 170 cm and a weight of 67 kg. The BMI of the patient is 23. Chief complaint: the patient having a fever of 38 degrees Celsius with a dry and frequent cough and the shortness of breath on expiration.
Medical history: COPD since 2024, chronic heart disease like rheumatic heart disease, a combined heart defect, hypertension stage 3, gallstone disease and hyperthyroidism.
With the help of the cardiologist, we diagnosed a patient with a right side polysegmental pneumonia.
Cardiologist suggested some medications such as antibiotics to treat the pneumonia. The doctor may prescribe antibiotics such as amoxicillin or ceftriaxone.
The doctor have advised the patient to take rest. Doctor strongly suggested the patient to quit the smoking. Further investigation you can tell.
Okay. So investigations include chest X-ray to monitor the progress of the COPD and the blood test to check the infection, inflammation and oxygen levels, pulmonary function test to assess the function to determine the severity of COPD.
Yash, what was your experience?
Okay. So I was posted on the 4th floor in Cardiological Department. I will tell you about one of my patients who was 68-year-old male. He had a severe pain and a sharp pain in his chest which is radiated to his left shoulder. He took the medicine nitroglycerin but his pain didn't stop. Then he was admitted to our hospital and the doctor in charge suggested him to do ECG.
An electrocardiogram is a non-invasive test that records the electrical activity of the heart over a period of time. It provides valuable information about heart rhythm, rate and function by measuring the electrical impulses that trigger each heartbeat.
ECG is performed by placing the electrodes on the skin, which detects the electrical impulses from the heart as it contracts and relaxes.
This test is commonly used to diagnose various heart conditions, to assess the medications and to monitor your heart health.
So I have his ECG report with me, which says that the ECG showed the ST segment depression in lead 1, AVL, V1, V2, V3 and V4 and V5 along with negative T waves. These signs of the ECG indicate subendocardial ischemia which affects anterior and the lateral part of the left ventricle. Importantly, R wave amplitude was preserved. There is no pathological Q waves, indicating there is not a ST elevation myocardial infarction. As per the ECG, we suspect that there is atherosclerotic blockage in coronary artery, especially in the left main branch, involvement of the intraventricular septum and circumflex artery. For further investigation, we send patient to angiography for further investigation of all coronary arteries.
So I was posted in Diagnostic Department where I got to know about ultrasound. Ultrasound of heart, which is commonly known as echocardiogram, is a non-invasive imaging test which uses sound waves to create image of heart on different planes. We should know the reasons why patient might visit a doctor and why doctor might suggest ultrasound of heart, which is echocardiogram, to the patient. Reason for visit of patient to the doctor for this test can be symptoms such as shortness of breath, discomfort, pain in chest, medical history and sometimes routine medical checkup also. And we should also know the reason why doctor suggests this test to the patient. It can be assessment of heart, cardiomyopathy and some heart diagnosis and many more. In our case scenario, as we can see, the patient was showing symptoms of shortness of breath, swelling in legs, fatigue, irregular heartbeat. And as per the history of patient, he was having diabetes, high blood pressure and heart problems. So we suggested him for echocardiogram. And As we can see in results, the result was abnormal, so we suggested him for further tests like CT scan and MRI for more information and suggested him healthy lifestyle.
I was posted to Radiological Department assisting a radiologist regarding scintigraphy. So my patient was 55 years old male. He is admitted here regarding his skeletal system problem and possibly renal function. Radiopharmaceutical uses technetium 99 metastable nuclear isomer, and the bold findings are increased uptake in sternum, clavicle, ridge, spine and pelvic bones, indicating regenerative changes in osteoarthritis. According to the report, the kidneys are normal in shape and function, so after suggested in further CT scan. Follow up, we will monitor his skeletal system and renal function.